How's it going, guys? Caden here bringing you a quick video. I wanted to do my 1-year post-op top surgery video today. It is a little over a year since my top surgery. It was January 12th. January 18th was the day that I saw my chest for the first time, so it's been a little bit over a year, about a year and a week at this point. I don't still feel like I'm in recovery at this point. I feel like I'm pretty much healed, although I do get some numbness, tingling, some pulling, things like that at times. But other than that, it's, pretty much totally recovered. So I'm going to show you that, where I'm at with my scarring, things like that, and talk a little bit about that now. This is my chest as it is now. So I had bilateral mastectomy. For those of you who have not watched my channel before, I went to Dr. Garramone down in Fort Lauderdale, Florida. Had an amazing experience. Highly recommend to anyone. The one thing I do mention is that I was cleared for reimbursement from Blue Cross. I met all their criteria. However, I did not get reimbursed for my surgery because the documentation that Dr. Garramone provides is not the same documentation that the insurance company needs. And even though we followed up with him multiple times, he refuses to provide any documentation outside of what he provides to you when you leave the surgery center. So that is something I like to bring up. Again, I believe it was worth every single penny. Great experience down there. I was down there for 10 days. It was amazing. I've had no problems. Would highly recommend to anyone. And he does provide that information before you go to surgery, that he will only provide this one document. So it just didn't happen, didn't get reimbursed. So that was a total of $7,800, I believe, that I paid out of pocket for surgery. Again, totally worth it to me. I'm so happy with the result. Honestly, can't believe that it's only been a year. This feels like the body that I've been in forever. I think it's just because, it's the body I felt like I should have had my whole life. And, kind of thinking back to before I had my surgery, I kind of disassociated with a lot of my life, or my, adult life before testosterone and before surgery, just because it was a very anxiety-provoking, depressing time for me. Obviously there were good things that happened during that time. Just thinking back now, I have to very, very actively pull those memories, because it just kind of feels like it wasn't really me. It was me going through the motions, but it wasn't really the life that I felt comfortable living. As far as that, it's been a little over a year, and it feels like it's been a lifetime at this point. As far as scar treatment, I really didn't do hardly any scar treatment, to be honest, and, I'm very happy with what I came out of. My scars stretched a little bit. As you guys know, if you've watched my previous videos, I did work out a little too early, so that I had some normal stretching on my scars, but other than that, they're not raised. They're very flat for the most part. Placement is perfect. They're not, super, super noticeable. As far as the nipples, I love them. If you look really closely, you can see where the stitches were. And that doesn't bother me at all. Obviously, this is scars that I'm going to carry with me for the rest of my life. They explain my journey, and I am okay with that. As far as those scars, I think they just give them a little character, So, not bad. Drain holes are completely closed. Can't even see them anymore. And then the scars are light enough that they don't bother me whatsoever. So pretty easy healing process outside of those first probably month or two of recovery. So really not bad. I was out to dinner with a couple other trans guy friends a couple weeks ago, and they had all had surgery as well. One thing that we talked about that I had never really considered much was nipple sensation and your nipples getting hard. So for me, that hasn't really happened yet. I would say, if anything, the left one gets a little bit of definition, but not really. The actual nipple, I guess, what you would say is it doesn't raise too much. It's a little bump, but it's really not raised much at all. So that's something that can happen, but doesn't happen for everyone. Personally, it doesn't bother me. I didn't really have much nipple sensation before surgery, so I wasn't really concerned about losing that. I can't really feel the difference between my nipple and my chest, other than the fact that, it's a bit raised. So, that doesn't bother me at all, like I said, but it's just something to keep in mind. He did completely resize my nipples and put them back on the areola and the actual nipple. So, I think that's just part of the method. Sometimes the sensation and the volume comes back, and sometimes it doesn't. So, That's just kind of been my experience. I haven't really noticed it until my friends were saying it, and he was like, oh, my nipples just started to get hard after a year of recovery. So, I mean, it could be down the road for me. I don't know. Yeah, ultimately, just great experience with Dr. Garramone. Loved it. He did feature me on his Wow Wednesday results on Instagram today, so go check that out. If you want, you can see my face on his page. Again, just very, very excited and happy with the results. It's been awesome. And if you have any questions regarding top surgery, feel free to reach out to me. I'm happy to answer anyone's questions. But other than that, thanks so much for watching. Hope you guys have a great day, and see you at the next video.